you for tuning in to another Dynamic Joint podcast. It is yours truly, your physical therapist, Dr. Tyre. Actually, your favorite person, me,
right.
Dr. Tyre.
And
just me. It's me, Dr. Tyre.
All right,
sitting here looking at all of you guys, looking at me, just here.
It's me as well.
I didn't know you were sitting there.
I'm here as well.
Hey.
Thank you. Dr. Angie, the OT and PT on this duo.
I forgot. Hey, friend.
Don't touch me.
Hey.
Cooties.
Hey.
Nope.
Hey.
Yeah. Tell the nice people why we're here.
Well, we are here so we can talk to you about what's the difference between PT and OT. But before we dive in, let's tell them about our business. We didn't tell them about our business.
All those people out there don't know about us.
They probably don't because we're not Beyonce status. So no, they don't know.
Not yet.
They don't know about
right.
us. But I'm Dr. Tyre again, co-owner of Dynamic Duo, and this is my best friend.
You better be nice because I was going to say something.
My best friend.
And I'm going to call you mama and tell you being mean to me.
My best friend and business partner, Dr. Angie, another co-owner of Dynamic Duo PT, and it is an outpatient occupational and physical therapy clinic located in West Palm Beach, Florida. So if you guys are in the area, stop by, look us up, stop by, say hi to us and say, hey, I saw you guys on the podcast. Y'all are hilarious. And Tyre, you're so beautiful. I'm like, oh my God, thank you. Here's an autograph.
Absolutely.
Whatever the case is.
They do that all the time.
All the time. Right. I'm like,
so they will come in actually and say, hey, Dr. Angie, you're so cool. I want to be just like you when I grow up. Like that's what they're going to be coming in and say.
Okay.
Right. But it's primarily because we do fantastic work in both physical therapy and occupational therapy. And that brings us right to our topic of today. Of
what is the difference between PT and OT,
right.
Physical or occupational therapy. Let me just tell you guys, PT is the best thing since sliced bread. Let me tell you, we are the ones that get the people moving and grooving. We are the ones that help decrease your pain. If you are feeling weak, you can call on us. If you are like stumbling and you lose your balance, call me any way you want to. Call me. Satisfaction.
All right, back to the script.
And then we also improve like your overall mobility just to help you and increase your quality of life, improve your quality of life, whatever you're going through. Physical therapy in a nutshell can help you get back to you feeling like you again.
Right. And she named a lot of things that physical therapy do. And I'm just going to say that OT, occupational therapy, is definitely the best thing. Because we are the sliced bread, if you understand what I'm saying.
No,
right?
So
we
don't understand.
Well, I'm explaining to the nice people out there, and you can sit back and learn something too, sister. Me. Now, occupational therapy is this brand, it's this term of we can do anything under the umbrella, right? We can help you get dressed.
That's true.
We can teach you how to eat again, teach you how to use the bathroom, take showers. A lot of those things are people that may have had a stroke or a brain injury or may have lost an upper extremity or lower extremity.
Or better yet, may have had surgery and they can't even use that limb.
Tis true. Look at you.
I know. I'm an honorary OT.
Right. But a lot of the times people don't understand exactly what occupational therapy does, and it's because we do so much. We can help you with walking. It's not called gait training like it would be with physical therapy, but we have to make sure that you can get to and from the bathroom in your bedroom when you're at home. You have to be able to walk or move that way. We look at everything and we do it all while having fun. So like physical therapy is going to make you do these old raggedy exercises.
To make you get stronger.
Right. OT is going to find a clever way of making you do those exercises, but have fun with it. Right?
PTs can be fun sometimes.
And because I am half PT, I will say you're right.
Thank you.
But OT has more fun.
I will say that to be true. Okay, caveat.
And we think outside the box, which makes us more fun.
Y'all do. I'm going off script. Okay, just bear with me. Come with me with this story. When we were in school, because first of all, I didn't like how y'all could have classes outside in the OT program, whereas PTs, we were locked in the classroom.
Talking about kick out a leg.
Having to read and listen to lectures while y'all outside having fun.
Right, because
and
OT...
I was looking out the window like, oh, y'all having so much fun.
And we played basketball.
Y'all were playing with dogs outside.
Exactly. We had to learn how to tie a shoe with one hand.
That's where I became jealous. That's when I became jealous of y'all.
Well, you should have switched your discipline.
I did not.
But it's a lot of fun. A lot of people don't understand that occupational therapy is not a step down from PT. Mm-hmm. They're actually really hand in hand, because most people have only heard about PT.
Right.
And so after shoulder surgery or, I have carpal tunnel, I need to go to physical therapy, those are actually realms inside of occupational therapy.
Absolutely. And I'm glad that you talked about the collaboration between PT and OT, because a lot of therapists, just collectively, PT and OTs, we work hand in hand together.
All the time.
And we're talking from experience. When we worked in hospitals, when we worked in skilled nursing facilities, when we worked in peds, we worked together because it helped the patient get better.
Right. Physical therapy works on the physical components. Mm-hmm. Occupational therapy works on the fun and functional. See what I did there, people? I went back to OTs having fun. We make it enjoyable because it's all about daily living.
It is.
Occupational therapy's goal is to get you as independent as possible.
And so you were talking a little bit in regards to adaptive equipment.
I didn't mention it, but
but you said it, like helping you work with tools and things of that nature. Like, you've mentioned it. I would not have conjured up in my head that you said something. No, you play the tape back. Play the tape back. But you said it, so therefore I want you to expound a little bit on it, because I think this is part of the coolness of occupational therapy. Like, if I was to go back to school and become an occupational therapy, I think this would be the reason why.
Right, so adaptive equipment is an extension of your arm or leg. For instance, if I had trouble after maybe having an elbow surgery or even a hand arthritic changes, I could actually use a one-handed fork or knife, so it's called a rocker knife, that would help me cut my food, so I didn't have to ask you to help me. Or if I had trouble buttoning up my shirt because I only had one functional hand, then there's tools for that too. So occupational therapy actually has a lot of tools in their belt that can make your life easier for whatever reason that it may be. After surgeries, I know you talked about surgery, so hip surgery, which we both would work with, would have difficulty putting on their pants because they have now restrictions of movements that they can't do. So occupational therapy has the proper sequence to show them how to do these things without breaking those hip precautions or needing assistance from somebody else to do it.
And also back precautions too. Like, I didn't even know until we worked together in the hospital when we had this patient was recovering from back surgery, and with those precautions, there's no bending, lifting, or even twisting.
Right, BLT.
But a lot of people don't understand, like, in order for you to wipe your butt, what do you naturally do? You twist. So
you have a bend there too, right?
So how can you manage toileting if you can't do these things? And having you come in, and either in working with other occupational therapists, come in and show like these different ways of doing things. I just think it is mind-blowing and also amazing, because I mean, we just show you how to get up from the toilet and sit down from the toilet.
Right.
Everything in between, I mean, it's needed and it's necessary. So I really do think I like what you said as far as occupational therapy and physical therapy work hand in hand.
Right.
Because it may seem as though PT may have like be higher than OT or vice versa, and that's not even the case. So I like that analogy that you said.
I think one of the biggest things that kind of drew my attention to occupational therapy, I remember one time we were in a driver rehab, so people that had an injury and needed to get back to driving, but they don't drive the quote-unquote normal way, i.e. with two hands and a leg. There was this guy pulled up in this big monster truck. He was probably about 37, 38 years old. And I mean, he jumped out of this truck. And when he jumped out, he had no arms. And like this is like a huge monster truck.
So like the regular Florida truck?
No, like even bigger. This is
What?
like I go mudding, like that
What?
type of truck. And so when he hopped out and he had no arms, like the first thing in my mind is like, who else is in there with him?
Mm-hmm.
Nobody. He drove the truck by himself. So they adapted the entire truck with occupational therapists to be able to allow him to drive, because again, the goal of occupational therapy is to be normal or independent. And that means if I need to be able to drive at 37, 38, I don't want anyone to drive me around. Right? He had 2 young kids, so him and his wife trying to understand, like, now how do we manage this day-to-day routine? Picking kids up from school, going grocery shopping. The way that he lost his arms was he was working on a telephone or electrical pole or whatever, and the truck that he was on wasn't grounded. So it immediately, as soon as he touched it, it blew off both of his arms. So now having this work injury at a young age and having to relearn this life situation now with completely different movement patterns with your body is huge. So occupational therapy being able to guide him along through the process, not only to help his mental, but to allow him to know that he can still do those same things that he wants to do.
And he's still human.
Absolutely.
And I just think that is so important, being a therapist, just treating our patients as such, humans. Right? And just knowing, like, what is it that you want to get back to doing? What is it that will make you feel like you again? And how can we, as your therapist and your support team, get you back to doing that?
And I think that's why people enjoy coming to our clinic, because while it is taught in school, ask the patient what they want to do what do they want to get out of therapy. I remember when I was first working, I would write it down, but I didn't make any of their interventions towards that. But now that we have our clinic, and now I'm more wise in our years, because I've been a therapist now for over 13 years.
Woo, girl!
I'm still young. I know I look it, and I graduated early from high school. I was 7.
In your wildest dreams?
And I was 12 when I graduated grad school. So I'm only 25 now. That's true. Based on a true story.
So what year?
I said it's based on a true story, which means that some of the facts may be fictional.
Well, okay, so
based on a true story.
So which
13 years is true.
That is, but how old are you?
25. Is
that true?
It's part of the script.
Okay.
Back to my story.
Okay.
That now I know how important it is that we make our therapy session geared to those people.
Absolutely.
So if they want to get better and play more tennis or play golf or wrestle around on the floor with their grandkids, like, we're going to get down on the floor and I will wrestle you. And I will be, I don't lose. I'm very competitive.
She will do such a thing.
If that is your goal, my job is to make it part of your therapy session.
Why? Because
that is what dynamic duo PT is all about.
You just missed that went over your head. Because you put the
fun and functional.
Exactly. So we talked a little bit about collabing or co-treating, if you will. Out of all of the settings that a therapist can be in, so skilled nursing setting, outpatient setting, school setting, geriatrics, hospital, am I missing something? Sports, outpatient, like, out of all of the settings, which setting is your favorite and why?
So I like our setting, so an outpatient setting, and the reason that I enjoy that is because I get to go along with the process. So I get to see them, quote unquote, not at their best, but I also get to see them when they hit their high point, when they're like, oh my gosh, I never thought I would be able to do this again. And in that time, you've created a family, and I think that's really, really big for me, is that I treat everyone as if we were related, because that means that the same care I put in you there is no VIP person, because everybody's VIP. I'm putting that care into you because I actually care, and I hope that when I need therapy, I'm going to find somebody else, because she hurts me on purpose.
Because she's a bully, so bullies get hurt.
But I think I enjoy the outpatient setting because of that. How about you?
Well, before we get into me, what discipline, like as far as whether it be orthopedic, so dealing with bones post surgeries, neuro, so dealing with any kind of brain body communication issues, whether you're working with like the little kiddos, so pediatrics, or our golden age individuals, so our seasoned saints, our geriatric population. Like, what population? That's the question. What population do you enjoy working with the most, and why?
So I'm going to say it's an adolescence to a young adult.
Okay.
I love my geriatric population 110% because they are very sharp and witty, and some of the things that come out of their mouth is hilarious.
Yes.
But I like that in between age because I get to challenge them a little bit more. I get to create things. Well, I don't say that because geriatrics, I create, honestly, some of the stuff that they do, I make the younger population do, and vice versa. So, but I like that young adolescent, young adult age because I can really, really challenge them.
Okay. So for me, types of settings, I like outpatient as well. Just because, again, the same thing that you talked about, seeing their progression, seeing how they walked in the door, being apprehensive and kind of like standoffish because they don't know what to expect, or they've been burned before by other therapy clinics. So like breaking down that barrier, and then just seeing them getting comfortable in the environment, getting comfortable with using whatever limb that's bothering them or whatever body part that's bothering them, and then getting them back to doing the things that they like to do. And then just having that moment of, oh my goodness, I didn't know that I can do this again, and just having like that aha moment, and then that also moment of having that level of confidence restored back in them. So I love that. In regards to the population, I love neuro.
You do.
I definitely enjoy neuro. I have a heart for them because it's, for an example, we have a patient currently on caseload, young lady who had a stroke, non-drug related, whatever the case was. I mean, like, it wasn't her fault.
Right,
it wasn't a dietary issue. She's not morbidly obese.
Right.
It was a hereditary issue that she ended up having a stroke. And what was so sad in her case was when it initially happened, the neurologist didn't push therapy, and this was something new for her. She didn't know, oh, I can have therapy because I may be able to get some form of function restored back to my body if I have the proper care or the proper system put in place. And this happened maybe 4 or 5 years ago, and now she's recently having therapy, and yes, seeing the potential. But what would have happened had she gathered or had she gotten therapy services back 5 years ago when it first happened, and how would that have positively impacted her life today? I just love the difficult cases where people or doctors have written off those patients. Oh, there's nothing left for you to do. You're just going to have to deal with where you are currently, and good luck. I like those cases because then that lets us know, like, there's still hope, because you're still human, right? So that's the population that I like, and that's the settings that I like. And given the fact, talking about doctors typically see or feel that PTs are superior than OTs. Correct. And again, just going back to what you said earlier today, like, we're on the same level. Right. There is no person or no discipline that's higher than the other.
And I recall one time we were working, I don't know where we were, but we were in a hospital working, and I was the OT assigned to that patient, and you were the PT assigned to the patient. Now, mind you, I am an occupational therapist, and I have my doctorate in physical therapy. So I am just as intelligent as Tyre. But because I was working as an occupational therapist, the doctor wanted to talk to the physical therapist about, is this patient safe to go home? Cognitively, the patient was not safe to go home. Physically, the patient could walk around and do what they need to do. So in Tyre's evaluation, it's, patient is able to move around. That's what the doctor wanted to know. I, on the other hand, as the occupational therapist, had the insight to say that this patient was not safe at all. Very impulsive, didn't understand what a toothbrush was from for our hair. Like, there were a lot of other cognitive issues that were going on that made the patient unsafe. But because the patient could move, the doctor said, well, physical therapy said the patient can walk so they can go home. That's where we talk to each other when we're co-treating. It's like, this is what I'm working on as an occupational therapist. This is what I'm working on as a physical therapist. And if there is no cross communication, then that patient would have went home and probably ended up back in the hospital with something worse from a fall, a fire in the house, or something of that nature. But because Tyre and I understand that we both bring our own perspective and opinion, but they have to coincide for the patient to be safe.
And at the end of the day, it's all about the patient. So being able to communicate that, not only communicate, but also listening to each other and not feeling like one, again, is superior over the other, and just taking everything into account, then we were able to let the doctor know, like, hey, yes, not functionally, but physically, the patient is able to stand up, to take steps. However, cognitively, they're not able to do so, and because of that, they are at a higher fall risk. So
they should probably go to a rehab or inpatient facility,
or a family member's home. That way they have somebody that's going to be there to help them do whatever it is that they need to do.
Right, and that is how we decide when we're going to send patients to eat, where they're going to go, and how we recommend things for them.
Absolutely.
But our fun fact, because we've come down to the wire now. Our fun fact. What do you think the personality type is of most physical therapists?
We're fun. That's the personality.
Yeah.
Fun
and rigid. More of that what type of personality?
Fun.
Type A.
Okay.
And you can see why. Tyre is very black and white. If it's not black and white, it doesn't have an option.
No, it doesn't. It doesn't exist.
And in my world, it could be as gray as could be. Everything is the right answer. You just have to word it correctly. Right? So I am definitely not a type A personality.
I think you have your moments of being type A.
Yeah, but mostly I'm not a type A personality.
Yeah. So for me, I like structure and I like direction. So you say, hey, this is what I need from you, A, B, C, and D, then great. Angie operates as just do it.
Read my mind. You understand what I'm saying.
The Nike logo. Just do it.
Just do it.
No.
And if y'all want to sponsor us, Nike, we'll wear your stuff.
Hey, we will. But until then, these Pumas are feeling very, very comfortable on these lovely toes of mine.
Yeah, it's a good one.
But yeah, that is a fun fact. PTs were more laser vision. That's the end.
And
OTs, y'all are more global and
fun.
Harmony.
Yeah, it's peaceful. It's like rainbows and unicorns over here.
Yeah, weird.
Hey, we're happy.
But that's what makes us us.
Right, and Dynamic Duo PT. So we just want to thank you guys for watching another episode. Stay tuned because we have more interesting stuff, more stories to be had, and you got to deal with her too.
Absolutely. So like and subscribe, and let's be out. I didn't know where I was going.
You done took somebody else's lingo. Right. So thanks, guys. See you soon on the next Dynamic Joints. You can't use other people's stuff.
But I like that. Don't worry. Call me.
Listen, we do not own the rights to any of this music.
We do
Please
not.
Don't sue us. We don't have nothing.
No, we do have everything, but we just don't want to be sued. Okay? Until